Hello, everyone. It is great to be back with you again as we start up a new season for my YouTube channels and also for the Mastering Pregnancy and Birth Coaching Program. What I'd like to do today is to give you an introduction to the Mastering Pregnancy Birth Coaching Program so that you know exactly what's in that program. It is not childbirth education. It is meant to assist families in learning how to understand the healthcare system so that you can have the very best pregnancy and birth experience possible. So with that being said, let's move right on in. Have a presentation to give to you. I'm going to hide myself a bit so that you can see the slides and we will move forward. So what we're going to do is to just welcome everyone who's here and hoping that you will enjoy this time and we will continue to press forward. Let me give you a little bit of my background. Why am I the person to be your coach for this program? Well, I have been a nurse midwife since 1979. I did clinical practice for 24 years. And besides that, I also have overseen numerous types of programs with family planning, maternal child health, reproductive health in the United States and abroad. I've taught and been on faculty at 7 schools of nursing, and I have been graciously awarded for my work by the American Academy of Nursing. I am now a fellow there, which recognizes the top 1% of nurses throughout the world. And through my professional organization, the American College of Nurse Midwives, I was the winner of their Lifetime Visionary Award, which is the highest award that they provide. And that was a couple of years ago. Last year, Who's Who in America noted me. So I think I can bring a little bit of expertise to you from what I have learned in my care for women and families over the years. Let me go through what I'm going to cover today. We're going to look at why maternal mortality is such an issue in the United States for women of color. We're going to look at the healthcare system. What are the options available for you during pregnancy and birth? Let's also take a look at maternity and paternity leave and what does your insurance cover? And what is it that you want from your pregnancy and birth experience? What is it that you really want it to be like? So I'm going to say, let's take 30 seconds to jot down what it is that you would want your pregnancy and birth experience to be like. We all have our ideas about what we want. We've talked with our girlfriends and we have some ideas how we want this to be. So let's take 30 seconds to jot down some ideas. How's that going? Great. Let's move on now. So why are we even doing this coaching program? I have been very, very concerned about the maternal death rate in the United States. And when we talk about maternal death, we're looking at how many women have died during their pregnancy and up to the 6 weeks after they've had their baby, which is that 42-day period. That is one way that we're measuring the maternal mortality rate. And I'm very, very concerned with what's happening with maternal deaths for women of color. Our population is dying at much higher rates than the white population the Hispanic population. So let's take a quick look. This information is providing information on what has been going on from 2018 to 2023. I have to correct that. It's to 2023. But as we look at all of the different columns, the blue columns are for 2018, the black columns are 2019, the gray 2020, the orange 2021, the teal 2022, the yellow or the is 2023. And what we see is that overall things kind of peak for everybody in 2021. And a lot of attention. It drew the attention of Congress. It drew the attention of many as to what is going on in the United States, that we have had all of this death occurring for women when they're having their babies. As you can see, those numbers dropped quite significantly in 2022. And in 2023, they actually went up for the Black population compared to the white and the Hispanic populations. And even as you look at 2021 and 2023, even though the numbers are lower, Black women are still dying at 3 times the rate of white women. That is an issue for sure. When are mothers dying is the question. Can you believe that in the first week after birth that mothers are dying? And then in the first year, we call it around the baby's birthday, is when the 57% of women are dying. So in the first week, we're at 43%, and in the first year, 57%. Wow. What's causing all of this? Can it be prevented? Mental health is the biggest cause. I was so surprised when I saw this. Mental health is the main reason why women are dying in the first year after they've had their babies. And this tends to affect white and Asian populations more so than the Black population. I'm not going to suggest that any of these problems are not affecting the Black community, but some are affecting different populations more than others. Hemorrhage is affecting the Black population and the Asian population. 14% of deaths are caused by that. Cardiac and coronary problems, that's the cause for 13% of the maternal deaths that are occurring. Those things can include such as preeclampsia, hypertension during pregnancy. These are coronary and cardiac issues. Blood clots are a cause for 9%. And then cardiomegaly is when you actually have a defect in the heart itself. That's causing 9%. I'd like to bring this home so that this seems to be realistic. When we talk about numbers and causes, it seems to be kind of out in the stratosphere. But if we can bring it home and put a face and name to these problems, it helps to drive the situation home a little better. Tori Bowie was an elite Olympic athlete who died of complications from, I would say, pregnancy. She died while she was still pregnant at the age of 32. And the cause for her death would be, it would fit under the cardiac problems, was eclampsia. And eclampsia, if you ask your grandmothers and your older aunties, they would talk about a term named toxemia. That is called preeclampsia. And also, when preeclampsia develops and advances, it gets to be known as eclampsia, which has a lot more complications affiliated with it. Serena Williams. Everybody knows Serena Williams. Well, she was 35 when she had her first baby. And Serena Williams, being an athlete, knows her body well. She had had previous problems with blood clots to the lung. And so, after she had her baby during the recovery time in the hospital, she had difficulty with breathing. And she knew that this was not normal. And she pleaded, she had to really plead to get the attention of the nurses. They wanted to just kind of, shove it off as a normal thing that happens after you've had your baby. But she knew that this was not normal for her. It was found out that she had a blood clot to the lung. Pulmonary embolism is the medical term for that. Beyonce. Beyonce was 36 when she had her twins, and she had preeclampsia. That was a problem for her. Even with being pregnant with twins and also with their preeclampsia, she spent a lot of time in bed rest. So this was something that Beyonce dealt with in her pregnancy. Kira Johnson. Kira was 39 years of age, very, very healthy woman. She actually had her pilot's license. She was very much in top shape physically. She went in for a repeat cesarean section. So this was a planned cesarean section. The surgery went well, but it was after the surgery that her husband noticed some problems. He noticed that there was blood in her Foley catheter tubing. And so he asked about this. It was ordered for her to have a stat test done to check on why this was going on. And stat means emergency, like it needs to happen now. And time went by before that test was done. He then advocated more. What's going on? What about this test? And advocated again and again. Hours passed by before she got the attention that she deserved. And they then took her back to open up the area where she had had her cesarean section, only to find that she had bled into her abdomen 2 liters of blood. And so this, I believe, was 2 or 3 liters of blood that she had hemorrhaged into her belly. She died on the table. She died on the table. And these are complications. That was hemorrhage that we talked about as a cause. Hemorrhage was the cause for her death. And to understand that there are complications that occur with cesarean section. Everyone needs to be very clear that cesarean section is major surgery, but it is one of the most performed procedures in the United States. But we have to remember that it is major surgery. Also, we know that Black and brown women are experiencing a lot of problems within the healthcare system. This is not only by what one is saying to each other, but we have plenty of research that validates that women are being mistreated, not listened to. And so these are problems that we're coming up with in the healthcare system. Even with that, we also know how difficult it can be to get that initial prenatal appointment. So there are many problems that we are encountering within the healthcare system for women of color. The questions that I would like to ask you, that as you consider when you're going to have your baby, where you're going to have your baby, who's going to take care of you, the questions that I would like to pose to you are these. What is the cesarean section rate for the hospital that you're planning to go to if you're planning to have a hospital birth? Do you know the cesarean section rate for that facility? Is that facility baby friendly? Meaning that you are the center of attention and helping you to be able to transition well after you've had your baby is high priority for them. Is your hospital a baby friendly hospital? How far are you willing to travel to get the care that you desire? Where my family lives and where I grew up, there are three local county hospitals, all within about a 30-minute drive from our home. And within that 30-minute drive, there are these three hospitals, and I looked up the cesarean section rates for those three hospitals. The cesarean section rate was anywhere between 27 and 42%. And so I would only need to drive 30 minutes to each of these hospitals, but yet I had the option of having my baby at a hospital that either had a 27% cesarean section rate or going to a hospital with 42%. So this is why I'm asking you, how far are you willing to travel? Another 15 to 20-minute drive would have gotten you to one of the best rated hospitals in the country for pregnancy and birth. Things to consider. Oftentimes, we are accepting the references from our girlfriends or from our mothers or our family members and not checking into this information. And you will be able to learn how to do that in this course. Consent forms. Do you understand what you are signing? I would say that there are many, most hospitals are now doing online consent, where they will forward you all the admission forms, pre-admission forms that you're needing prior to your hospitalization, and are asking you to provide consent online. My question is do you understand exactly what you are signing? When you do informed consent, there are certain questions that should be answered for you before you actually are signing that consent form. And this course will review those things with you so that you understand what are the kinds of parameters that should be answered within consent forms. Have you had the opportunity to think about these things? Have the reasons for the need for procedures been explained to you? Do you know the risk and the benefits of those different procedures, whether you choose them or not? All of these things are parts of the consent form. And you do have the right to actually cross off some things in the consent forms. So the course will review this information with you as well. How about insurance and parental leave? What does your insurance cover? There may be things such as home visits that are covered by your insurance plan. However, that may not be offered to you by your provider. But it's something to know that it's important to be able to have a home visit after you've had your baby when we look and see that women are dying within the first week after they've had their babies. How about parental leave, meaning your paternity and maternity leave? Do you have that? Is that leave paid leave or is that unpaid leave? Do you know how much time that you have, how many hours or days off that you have? This too will also be discussed and covered in the Mastering Pregnancy and Birth Coaching Program. We know that the lack of maternity and paternity leave can be problematic for women. It's a big transition once you've had a baby and then you're coming home, and particularly it's an addition to your family. There are healthy stressors that are associated with that, but all of these things are really important. And if you don't have maternity or paternity leave, it forces mothers to go back to work earlier than what they wanted to. It forces you to work up to the day of your delivery date, when you may have a desire to be able to be off a week or two prior to the delivery date. when there's a lack of insurance, there is ways to be able to make up for that, such as short-term disability, and we will cover that within the course as well. So when we have lack of insurance, when we are not certain about the providers that we are working with or who's caring for us, these things can bring a lot of stressors that you really don't want to have to be worried about during pregnancy, but these are things that are there. And what I'd like to propose to you is to say that it really does not have to be this way. It doesn't have to be this way. And so, therefore, that's why I have brought forth this coaching program. I want to go back to the question that was posed earlier. What do you want your pregnancy and birth experience to be like? And I want to also say to you that these things can be yours. They can be yours. In the Mastering Pregnancy and Birth coaching program, I want to empower families to know that they can take control of their health, that you're able to improve any health risks that you have going into pregnancy, that you can choose your health providers with good information about them, that you can choose the location of your birth, that this is something that you will do based upon the information you're learning about those different birth locations, and that you are able to make deliberative, on purpose, informed decisions regarding your pregnancy and birth. That is my desire, that at the end of this program that you would be feeling all of these things. So what is it that you're going to learn in this coaching program? Let's review that. Let's look at what's inside of the program. Well, the program is 4 modules that are being offered over a 4-week period. There are 11 lessons total over those 4 modules. These modules are all online with audio and video, and there are some attachments for you to complete to help you gain the knowledge that you need, some exercises to guide you through these lessons. The first module will be week number 1, where you will go over understanding your health history. You will gather your personal health history and the health history of your family. This is so important because your health history will help to indicate what can be some of the health risks that you might encounter during pregnancy and after you've had your baby. You will also know by the end of week 1 how much weight you should gain in pregnancy. That's always the ticket question that many women ask. How much weight am I supposed to gain during pregnancy? Well, that is based upon your body mass index. And so you will learn your body mass index, and from that, you will know exactly the amount of weight that you should be gaining during pregnancy. You will also know and learn what is your normal blood pressure for you. And if you don't know how to take your blood pressure, then this lesson will show you how to do that. Module number 2 is going to move into the area of insurance and finances, and also leave. Looking at what does your insurance cover? What kind of insurance plan do you have? If you do not have insurance, how are you able to get onto insurance? Do you have emergency funds? There will be things that can come up during pregnancy and post baby's birth that can be emergencies where you would want to have money set aside to be able to take care of those emergencies. When you have set money aside, it will also allow you to pay for those leave days that you want that may not be paid for by your employer. And also just looking at exactly knowing exactly how much maternity and paternity leave you do have, and show you about short-term disability, which you can purchase that will give you coverage for 6 months, up to 6 months. Modules 3 and modules 4. 3 is going to look at your health providers and also the different safe birth locations for you. We're going to go through every possible provider that you would encounter for your pregnancy and also for your baby's care, looking at how much education they're getting, looking at their licenses, their certifications. You know that you can actually look up this information for each of these providers. You can see whether or not there have been any adverse actions against the provider with the state medical boards. We will review all the different types of facilities. Not everyone wants to have their baby in a hospital. We will look at what are safe, I would say, safe requirements for being able to have your baby in a birth center and also having your baby at home. And I am going to emphasize safe because there are times that it's recommended that you should move into a hospital facility, or whether or not it's even a safe idea for you to have your baby at home or in a birth center. Also, this course will show you how to find out the hospital safety grade. Is this a safe hospital? What are the weak areas that they have? Also, what is the cesarean section rate? You can find out that information. You can also find out what hospitals are designated as being baby friendly. These things are very, very helpful as you consider where you want to have your baby. Because if you want, for whatever you're wanting in your birth plan, you want to be in an environment that's going to support you, not an environment that's going to fight you all along the way. And the last week, we're going to get into informed consent and birth plans. There will be an actual informed consent diagram for you to look at, a consent form that you may get online, and to compare in that consent form, does it meet the requirements for informed consent? So we will review that. And then once you now have all of this information, now is the time to write the birth plan, where you've got great information in regard to your own health risks. You have great information in regard to what type of birth you want, what are the type of providers based upon your health risks, and what you want your birth experience to be like. The goal being to have a healthy mom, healthy baby at the end. This is module 5, but it's really not another week. I am offering a 30-minute personal phone call with those who are participating in the course. And with that 30-minute phone call, it will allow you to discuss any personal information that you may have come across when you did your personal and family history. And if there were any particular personal questions that you might have, I would be able to answer those in that 30-minute phone call. I will, throughout the course, meet with everyone in the class once a week to answer any questions that you might have as you move through the course, in terms of in the materials, to make sure that you have no questions around the materials that you are listening to and any of the attachments that have been provided to help you accomplish that particular lesson. So why should you buy this course? That's the question, right? Why should I even do this class? Why should I invest? There are some takeaways that you're going to get from this course that you will be using not only during the course, but for life. Once you know your personal and family history, you really only need to gather that information one time. And then as things occur with you or members of your family, you would update that information. So it's going to take a little time to gather all the information first. And then as you continue through your pregnancy and then on with life, if there are changes to your health status, you would indicate that. If there are changes to a family history status, you would indicate that. But you would not need to, again, do a full blown collection of information that you will do for this course. So you'll have that information forever. Once you have gathered that family and personal history, you will be able to know what are your own health risks, not only for pregnancy, but also for the rest of your life. Give an example. If you have someone with a family history of diabetes, then you will be tested for diabetes during pregnancy. If you were to have what's called gestational diabetes during pregnancy, then you are at a higher risk for developing diabetes later on in life. So it's great to be able to know this because we can control the onset of diabetes. That can be controlled with diet, weight management. The other is understanding your insurance, knowing what health services that are covered by your insurance. Once you know that, unless you change insurance plans, you will have a good, firm sense as to what is covered. In terms of leave for parental, being paternity or maternity leave, you will know what you have, and oftentimes it's the collection of your sick leave and annual leave. If you've not been doing that, this will allow you to have a firm handle on that so that you can take the leave when needed. You can know what are the health services that your insurance covers and where there might be gaps that you can fill. Understanding informed consent is really important. We do this every day in our lives in terms of providing informed consent. Anytime you download an app on your phone, they're going to ask for terms and conditions that when you accept that app on your phone, that you have basically agreed to the terms and conditions. Whenever you're buying things online, you may be agreeing to the terms and conditions. When you get credit cards, you are agreeing to terms and conditions for that. When you buy a car and you sign a loan for that, you are being, you're signing for the terms and conditions of the loan. So it's very important that you understand everything in that document so that you know what exactly you're signing for. So what I am proposing to you is that the information that you're learning in this course, you'll be able to use for lifelong decision making. You'll be able to use it now and also in the future. You will also be able to really make decisions about what are those things that you want for your pregnancy and also around the time of labor and birth that are important to you. What are the things that can be retained no matter what happens? Suppose your labor needs to be induced or you need Pitocin to help your labor along. Um, you can, from this information, still have a number of things that can be met. Uh, Things like birth ball, things like whether or not you're able to use the tub in labor, questions around whether or not you want your baby to have vaccines or particular injections such as vitamin K. Is that something that you want to have your child have? Whether or not you're able to eat and drink and move around freely in labor. That is going to differ depending upon where you have your baby. And so all of these things can still be an integral part of a birth plan. And once you have some understanding of your health risks, once you have decided about where you are going to have your baby, as I mentioned before, you want to, as much as possible, be able to be in an environment that's going to support your desires and wishes. As long as things are moving along fine, you still want the support, even if there are interruptions to what the plans had been for labor and birth. Now, the Course is $497, and you might think, well, gee, what am I getting? You're going to have 1 year access to all the materials that are in the course. And so, even though we go through this course in a 4 week period, you will still have access to all of the materials for up to 1 year. You will also be a part of a private online community with others who have gone through the course that you can bounce off questions and support each other as you go through the course. As I mentioned, there will be a 30-minute private session with me, and that is a cost. If you were to have a private appointment with me, it would be cost related to that as well. Increase confidence to be able to voice what it is that you want and desire. You will have more information in terms of writing your pregnancy and birth plans. This course is worth $2,800, but you're getting it for $497. So that is the great bonus with this. If you have any questions, I am open to hearing your questions. So I'll take a few minutes to take your questions if anyone has any. I will move on then. This is the link to the Mastering Pregnancy and Birth Coaching Program. I am going to be offering $25 off for the first 5 students who will sign up until September 15th. The course will be released, the first week will be released at 5:00 p.m. on September 15th. And so for the first 5 students who sign up, you will get $25 off of the course. So I would say, I hope you consider this if you are planning pregnancy in the next 1 to 2 years, if you are currently pregnant, if you are a birth worker. I had doulas in my last course that I offered, the last cohort through, and they really enjoyed the material in the program. And for families who want to support each other during this program. So thank you so much for your time. And I look forward to meeting you in the course on September 15th. Thank you so very much. Bye-bye.